Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejob since time immemorial. UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, Twitter, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. Your facilitators today include our host, Erica Burrows-Girardi, with support from CHR&R Communication Specialist, Colleen Wick, and the Collaborative Learning Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation immediately after the webinar in our discussion group. Joanne Lee will be our lead facilitator. And watch for a chat from Colleen for details on how to join the group after the webinar.
Welcome to Partnering with Faith-Based Organizations to Improve Health Equity. Hi, my name is Erica Burrows-Girardi. Let's start with our values. CHR&R's webinars reflect the values that, and I apologize for that. CHR&R's webinars reflect the values that hold us as part of the University of Wisconsin Population Health Institute. Values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are values that we aim to model during the webinar and hope that you will too. We invite you to join the conversation and engage with us during the webinar. Now, there are two ways to engage, and I apologize. I wanted to ask Joanne to do this. Joanne?
Hi, Erica, and hi, everybody, and hi to everybody in the audience. Thank you so much for joining us today. It's going to be a really great, interesting webinar. As Erica started off letting us know, there are ways to engage with us during this live webinar. One of the ways is to use the Q&A box. Now, the Q&A box is specifically for questions that you want the panelists or the guest presenters to answer. So anytime as questions come up, you can enter a question in the Q&A box for our panelists, and I will be in there just sort of monitoring the questions and grouping really common questions that we can pose to the panelists at the end of the webinar where we'll have time to address your questions. There's a second way to engage with us during the live webinar, and that's the chat box. And I will introduce you to Colleen Wick, who will tell us how you can engage in the chat box.
Thanks, Joanne. Hi, everybody. My name is Colleen, and like Joanne said, I will meet you in the chat. So please use the chat to share knowledge or respond to questions that we ask of you during the presentation. And please also join us in making the chat space welcoming by adhering to these guidelines. Share successes, lessons learned, relevant resources, and links. But please make sure to engage in a respectful dialogue. Since, as you could probably tell from all the chats coming through, our chat conversations tend to be very engaging. So if it's too distracting, just simply close the chat window. Also, please know that the views expressed by speakers and participants are their own. They do not represent CHR&R or Healthy Places by Design. And again, if you have questions for the panelists, please use the Q&A box. And now I will pass it to our technologist, James.
Thank you, Colleen. I'm James Lloyd, and I work as the technology coordinator for County Health Rankings, and I'm here to help with the technology of today's webinar. If you have any issues connecting or hearing the slides, hearing the audio or seeing the slides, send me a message in the Q&A pod, and then I can have a conversation with you there to help make sure that things work and you have a good experience. I'm really looking forward to this topic, Erica, and I'll pass it back to you.
Thank you so much, James. And I'm obviously one of those who ended up getting distracted, but that's not going to happen again. So, the University of Wisconsin Population Health Institute envisions a world where we value each other, honor our connectedness, and build communities where everyone thrives. Faith-based partners are positioned to help us achieve this vision. And as I meditate on this vision, I can't help but think about the humanitarian crisis that we're all thinking about, right, in the Middle East. And I want to repeat what UW-Madison's Chancellor Jennifer Mnuchin said. To the great many people in our community who have friends, family, and loved ones in Israel or the Palestine territories, my heart goes out to you. Faith institutions are rooted in our communities. They are a major ingredient of the family and social support that we need to thrive. And they're all also are civically engaged, often helping to meet basic needs such as hunger relief, housing, disaster relief, and more. And faith communities have a long history in partnering in social justice movements. Faith communities were the backbone, for instance, of the civil rights movement. More recently, faith communities or faith groups are allies in criminal justice reform and civil rights for immigrants. At the same time, it would be irresponsible for us not to surface that religion has been used to justify systems of oppression, stripping people of their culture, and even genocide. The Doctrine of Discovery by Stephen T. Newcomb is a documentary that sheds more light on how religion was used to justify colonization and imperialism. While some of you may have worked with faith partners in the past, others of you may have found religion's troubles in history a deterrent from partnering with faith groups. We will get into some of those tensions in today's webinar with our guest. And with that, please join me in welcoming David Liners. David is the Executive Director of Wisdom, which is a Wisconsin network of faith-based organizations. Hi, David.
Thanks for having me.
Thank you so much for joining us. And I also want to ask you in join me in welcoming Kathryn Lozada, the Southern Minnesota organizer with Isaiah. Isaiah is a statewide coalition of faith communities in Minnesota. Hi, Kathryn.
Good afternoon, everyone. Thanks, Erica.
And thank you for being with us today, Kathryn. And you can read more about our speakers' bios by visiting the webinar resource page that Colleen is chatting out right now. Now, here are the areas we will cover today with our guest. What are the values that unite faith and public health partners? What are some examples of faith-based work grounded in equity and social justice? And what are strategies that faith partners are using to bridge divides for policy? We will have a discussion group right after this webinar to unpack what you're going to hear today. Please plan to continue to join the discussion with us. During the video intro, you heard about the discussion groups that follow the webinar, and they are facilitated by Joanne Lee. They're always engaging, giving you an opportunity to share and learn from others. Colleen will be chatting out the information at the end of the webinar, so you can link to the discussion group after the webinar. So with that, please join me in welcoming David back. Hi, David. Now, I just want to point out that I know you were having a little bit of technology issues. The power went out in your office and you were able to find another place to join us. So feel free to turn off your camera if things start getting shaky with your internet. We will totally understand. Uh-oh, and I think he's frozen. So you know what? While David catches up, Kathryn, I'm going to invite you to come back to the mic. We're going to start with you. And what I want to do is I want to ask you a little bit about Isaiah. What's your mission and why is this work so important to you?
Thanks, Erica. So I was raised in a very social justice oriented faith community in the suburbs west of Minneapolis. And I grew up like looking up to elders that constantly ask the question of how do we love our neighbors in everything that we do, in our
Mhm.
relationships, in our systems, calling on our government to be a better neighbor. And I could see them like living out those faith and values in action with pollinator gardens before they were cool, being part of the sanctuary movement in the 80s before I was born, partnering with and learning from nearby Indigenous and African American communities, and not assuming we knew what was best for them, but how do we partner with to strengthen our communities together. And as a teenager, it was really hard to reconcile, like some of you are already naming, how amazing my home church community was and how much humans still hurt each other, often weaponizing organized religion to justify oppression, like you, Erica, named at the beginning. And I was pretty overwhelmed by all of the pain in the world and
Mhm.
tried to discern what I, as one person, can do. I studied international relations, and more of my background is in the intersections of immigration justice and education equity. And I will say, I never thought I'd be a community organizer. I actually grew up like an awkward, nerdy only child, terrified to talk to people and share my full self. And I'm really grateful to have the systems perspectives, because it helps me see the interconnectedness of so many issues and people, of course. But a friend introduced me to Isaiah, and I saw white, black, and brown people from different walks of life all trying to
Mhm.
figure out how to build beloved community together. And now I've made 6 years as a Southern Minnesota community congregational organizer, with Isaiah, and work in a set of communities south of the Twin Cities. So, like you shared earlier, Isaiah is a home for people of faith and shared values who are acting collectively and powerfully towards racial, economic, and climate justice in Minnesota. And it's been around since the year 2000, and has expanded significantly the last few years from mainly Christian congregations to include the Barbershop and Black Congregation Cooperative, Muslim Coalition, Kids Count on Us Coalition that organizes community-based childcare centers, a young adult coalition, and the Rural Organizing Project. So we talk about like different rooms of the house of Isaiah, all try to meet people where they're at, build
Mhm.
trust, see ourselves in one another, and then work together towards a people and planet centered democracy where all of us can thrive.
I love the fact that you all seem to be at every corner of Minnesota and working with all populations and it's intergenerational. I think that's amazing. But you are centered there in Minnesota. And I wanted to ask you about how your organization or maybe your partners, how were you all impacted by the tragedy that centered around George Floyd? How
Thank
did that
you.
impact your work?
Yeah, absolutely. I need to name that my work in southern Minnesota felt a bit removed from like the heart of pain in Minneapolis, where George Floyd was murdered. That directly impacted many of my colleagues and the beloved communities they organize, like the epicenter of compounding trauma, law enforcement escalation, neighbors really relying on each other to keep each other safe and literally like put out fires together. And what happened in Minneapolis clearly had ripple effects across the state
Yeah.
and country. We saw some politicians like ramp up their divide and conquer rhetoric and not so subtle dog whistles, basically saying Black and Brown folks who live in the cities are scary and dangerous, and trying to pit us against one another by skin color and where we live to undermine collective solutions that could keep us all safe.
Yeah.
Um, so we had to listen to people directly impacted in Minneapolis and also act from where we were and really talk about racial injustice head on, and
Yeah.
lots of intentional conversations with people we know and love in congregations, door knocking neighbors when we could do that safely during a pandemic. We were trying to really listen, meet people in their fear space sometimes,
Yeah.
and try to reground that no matter the color of our skin, most humans want the same things. We want to feel safe, care for our loved ones, have enough resources to thrive. And that really helped us shift the conversation
Yeah.
from a
Yeah.
really like binary, more or less police reaction to reimagining public safety, and let's fund things like affordable housing, healthcare, mental health care, schools, youth programming, and the right qualified professionals to show up for us in crisis. And sometimes that's law enforcement, sometimes it's a social worker, a housing caseworker, sometimes a combo. And this work is ongoing in Minneapolis and statewide, but we did make some good progress in the recent state legislative session.
And I love the fact that you all were able to redirect that conversation and out of that tragedy show that everyone still has a role in creating good. I just that's tough. And so thank you for sharing that because I know that must have been a really hard time for you. It was a really hard time for us across the country, but for those of you who are living in Minnesota, I would imagine that it was just a little bit more impactful. Now, you were talking about those policy wins, and we're going to get into that because that's something that really astounds me, the policy wins you have, and I can't wait to share that with our audience. But I was just surprised to learn that Isaiah has been able to create a coalition that's been so effective in policy change. What strategies do you use to build support?
Thank you for that. So on the slide here is our Claiming Our Voices faith agenda. And
Mhm.
so I want to name, this is our guiding vision statement, and everything we do tries to make this a reality in the world. And we equipped regular people to have conversations in their relationships, in house meetings, in congregational forums. 5,000 people across the state had conversations like that in 2017 to really shift our organization from a season of prophetic resistance to the real harm the Trump administration was causing our communities, to not just play defense, but really get clear on what do our communities need? What are we for? And we had to get, courageous to get out of partisan assumptions or headlines and have conversations rooted in shared values and how the
Mhm.
current systems are violating them and impacting us and people we love. And from there, we can see we're more interconnected than we're told, and we can come together across race, faith, and place to shape priorities to work on together. And I know you all are working in the health field, and health is interconnected to so many issues
Yeah.
like housing, mental health, education, clean energy. And inclusive democracy is foundational to make sure that we have responsive decision making that actually addresses our community's need. Um, so the center of this too is like, I can't do that alone.
Mhm.
Community organizing is rooted in agency and leadership development, that regular people should get to be at the center of the decisions that affect their lives. And it takes,
Yeah.
thousands and thousands of people to work together across race, religion, gender, geography, and age to make
Yeah.
big impacts on shared interests. And then we also work with an amazing communications team, always learning, researching, message testing of what will ground most people and move those open to it to support multiracial democracy and collective solutions. So wanted to give a
Yeah.
shout out to them and our national partners like Anat Shinker Osorio, who have developed and continue to update the race class narrative, which then we train ourselves and train our volunteer leaders to
That's
really
awesome.
inoculate like the dog whistles,
Yeah.
and what will move people to like make the faith agenda a reality
Yeah.
together.
I want to share that this slide is so meaty. It's so good. Like, and by the way, Colleen has already chatted out a link, so you can grab the slides to see them. But it's so meaty because I want to show it. I'm going to flash it one more time. And for those of you who are in public health, you're going to see some words that really look familiar that Kathryn so nicely bolded for us. Safe and dignified places to work, affordable healthcare, guaranteed healthcare, equitable access to finances, that kind of stuff. These are things that really bind public health and your work, which is also faith-centered. But there's one thing that I know from working with public health partners, there's one thing that kind of gives us some pause. And that word is equity. Now, some of us struggle with it because in some communities, equity doesn't necessarily have a positive connotation. How does Isaiah wrestle with that tension, with the mission, with your mission and your work?
Yeah, absolutely. It's important to tailor our language to meet people where they're at. And sometimes that word equity or other words we might use may turn some people off and kind of stop the conversation right there. And it's helpful to ask, like, what do we actually mean by equity? One strategy that I love, I learned from our communications team, is they talk about the brownie box. So often people assume change happens by arguing that it's the best ideas, but that's not always how change happens. The recipe on the back of the brownie box is wonky, and the word equity feels wonky. We actually have to paint the picture to people of like the ooey gooey brownies, the finished product on the front. And that's the side that will face out on the grocery shelf and entice people to pick up the box.
Yeah.
So I'd be curious to learn from you all, like, what is the brownies of health equity? And I might frame it as something like, no matter what we look like or where we come from, everybody can get the quality care they need affordably and close by. And we find most people agree with that across the
Yes.
political spectrum. Of course, if they're open to that kind of conversation, we might have different ideas about how to get there, but at least that can have a more constructive conversation. And then the other thing I'd say is, like, equity isn't the frosting on the cake, it is the cake. It should be baked into how we think about policy solutions and always be asking who's left behind, why, how, and what can we do about it.
I love that. I love that. Let's get into those policy wins that you all have had, because you guys have been pretty successful in engaging policymakers. And I want to share some of these policy wins that you've had. Let's talk about them. So, inclusive democracy is something that you talked about early on, how important it is in this equity space. What are some wins that you've had in to make democracy more inclusive?
Yeah. So, as I was sharing earlier, like, inclusive democracy is really the foundation to make sure that we have responsive decision making and that our elected officials are supposed to work for us and with us. It takes a whole lot of people to demonstrate the demand of what our communities need and how do we work on those things together. And again, Isaiah is one organization. I think it's amazing, and we can't do it all alone. So we do work with a whole lot of partner organizations. We build coalitions with other organizations with aligned interests, like unions like the AFL-CIO and SEIU Healthcare and other community-based organizations. But we first, with the listening work, identify what do our people need, and then strategize and invite lots of regular people into action to make it happen. So on that first bucket, I'll go through 3 buckets of policy wins we've been working towards for 5, 10, 20 years, and sometimes local campaigns to make a step in that direction and elevate that demand to the statewide level. So you can certainly learn more. It looks like links will be coming into the chat if you want to read more, but I'll give the very top notes here. So on inclusive democracy, we restored driver's licenses for all. So Minnesota residents, regardless of citizenship, can get a driver's license to fully participate in community. That was taken away in 2003. And that was some of our immigrant neighbors' top priority to restore. And we did that this year. We also passed Restore the Vote, which was another 20-year fight, so that 55,000 neighbors living in our communities after incarceration can just get those voting rights restored the second they're back in community, rather than waiting sometimes decades until they're off probation or parole. And then the big package was the Democracy for the People Act. That included a bunch of other good stuff, but the things I wanted to highlight here are automatic voter registration, pre-registration for 16 and 17-year-olds to get young people like ready to roll the second they turn 18 to participate, and more support for accessibility, language justice, supporting those who are running our elections and are facing more threats these days, so that people can have their voices heard.
Yeah. And I know climate change is something that's really important, especially in public health. In fact, we're going to be doing a webinar on climate change before the end of the year. So what are some climate change or just climate wins that you all have experienced?
Yeah, so with, again, a whole lot of partners and the 100% coalition of over 50 organizations, we made some big steps towards clean water, clean air, clean energy for all, that just future that feels like I have a chance to thrive in my future too. And of course, the generations that come after me. So the biggest thing is moving all of our energy sector, our utilities, to 100% clean energy by 2040. We also recognize that the transportation sector is the biggest sector of greenhouse gas emissions in Minnesota. And so moving to cleaner cars and equipping more people to travel by sustainable transit is huge. And so we passed $500 million a year for new transit funding. And also our Department of Transportation will take climate impacts into consideration for new infrastructure projects. So of course, safety comes first. Climate is a close second, and that is like some nation leading stuff. So now Minnesota's leading, at least in the Midwest. Invite more of our neighbors to join us in that work. And then, of course, more of you all are on the forefront of the caring economy. And we've been hearing a lot of our people have been in care crises for a long time. And the US is one of two countries in the world that has no like national paid family leave program. And when you have a new baby, adopt a child, have a health need yourself, or take care of a loved one, you should just get to focus on that care and not worry about breaking the bank or losing your job. And so we've passed a really comprehensive statewide paid family and medical leave program so that the vast majority of workers, there's only a sliver of workers in Minnesota. Most workers will be able to take up to 12 weeks off and get most of their salary reimbursed when they need to care for a loved one. So that's very exciting. And I got to work significantly to help get that program across the finish line. And then a step in the direction of a universal healthcare system where we all get the affordable care we need close by is passing the Minnesota Care Public Option. And that was not a guarantee. It passed with like 4 days left of legislative session this year. And that makes sure our Minnesota Care Good public health insurance program will be expanded from just those making below 200% of the federal poverty line, will be expanded to all Minnesota residents, also regardless of citizenship. So that is significant for our immigrant neighbors, often who are at the forefront of really, really challenging work. So that will be huge and getting phased in the next few years. So we want to make sure that gets implemented well. And then, of course, affordable childcare, affordable housing are two more significant buckets that we had big wins on. And we have more work to do for real sustainable funding going forward.
Yeah, this is amazing. Congratulations on that, Kathryn. And when you get your handout that Colleen's already sent you a link to, you'll be able to click on this slide to find out some more information about the policy wins that are there in Minnesota. I think this is amazing work that you all have been able, because of your partners, have been able to get this so much passed that really squarely falls into the public health space. So congratulations on that. I know you really wanted to share a lot of some stats about your legislative session. So we're like, okay, let's squeeze this in. So share this information, and I have a couple of more questions for you, and then we're gonna see if we can get back to David.
Absolutely. We'll try to do this quickly, but I wanted to make sure we highlight it wasn't just our amazing policy director like trying to get in there in the Capitol and meet with legislators. He was working with us and thousands of people across the state, regular people, like demonstrating Minnesota wants this across our whole agenda and taking action in a variety of forms to make it happen. So we had lots of contacts to legislators for our agenda, strategy meetings. We shaped the narrative with social media, letters to the editor, faith leader sign-on letters for particular issues. And then, yes, this next slide demonstrates we had key moments at the Capitol where we tried to gather hundreds of people together, us and partners, to again demonstrate that demand. Big coalition rallies. We also equipped regular people to have presence and share their testimony of how an issue would impact them in key hearings. And then sometimes we had prophetic delegations to the Capitol and visited, brought people to meet with their legislators. I work in greater Minnesota outside the metro. And so sometimes we had to organize carpools and buses.
Mhm.
And that's where we drew from the strength of a statewide organization to meet our people that could get there more easily. And then I tried to bring the Capitol to us. So a lot of Zooms, just like this one, this picture. So one of the things I'm proudest of is over the last few years, building a cohort of 6 partner legislators across the region of Southern Minnesota who share our orientation and commitment to our agenda. And they met with a group of our people weekly, like 30 to 50 people across our region. We learned from one another. How's it going inside the Capitol? Where can we take action? How do you need to hear stories from us to help these things get across the finish line? And we also invited legislators to meet with us in community.
I love that.
Sometimes smaller roundtables like faith leaders or small business leaders, barbershops, even invited the Speaker of the House. And then this picture is one of our larger, we'd call an in-district event, where I organized 80 neighbors across race and faith to push in the final stretch on our agenda. Our people told their stories and asked, how are you going to lead with us through the rest of the session to deliver?
That's amazing. I want to ask you, how do you envision public health and faith being able to work together? You have, we have similar agendas. We have similar wants and needs and desires. How do we connect with faith partners?
Sure. So I hope we can discuss this more in the discussion group following and be curious to hear more what's coming up for you all. But what I would say from the organizing side is start from your own relationships and your own groundedness. Maybe you're part of a faith community or have friends or family who are. Are there faith-based groups close to you? Like, we're a part of the Faith in Action National Network. You can check it out to see if there's an affiliate near you. And then the building block of community organizing in a sustained way is intentional conversations to find out what you both care about and why, and is there a potential to work together? And I try to always ask for referrals. So, like, who else do you think would resonate with this kind of conversation? Who else should I talk to? Go ahead.
No, go ahead.
I was just going to say there's many people with different angles to healthcare in faith communities. So we organize some of our own members are social workers, nurses, doctors, therapists to bring that expertise, as well as, a whole lot of regular people just trying to live healthy lives, but it's too hard, expensive, far away. So you each are the experts of your experience, and we get to learn from each other and find that common ground going forward.
I love that. No, I was just going to reiterate exactly what you said, that, you unite with values, unite on that common ground. So even if you're not a member of a faith community, doesn't necessarily mean you can't partner with someone in a faith community because of those shared values. That's all I was going to say. So, but thank you so much, Kathryn. And we do have some questions for you, but I want to circle back to David, and then let's circle back to you in a few minutes and ask some questions. So, David, how are you? You're back.
I'm doing well. The power went out in part of our building, and it's the part where our internet is. So I've found a different place, and I'm borrowing a neighbor's internet. So let's hope it holds up for.
I know.
Time, but thank you.
Well, again, you feel free to save some bandwidth with turning off your camera. We've all been there, so it's fine. I want to kind of start with the same question that I started with Kathryn. Like, what is Wisdom's mission, and why is this work important to you?
Sure. So Wisdom, I mean, we're not unlike Isaiah in a whole lot of ways. We're primarily communities of faith around our state. We also have a sizable part of our membership that is people who are directly impacted by the issues we're working with. For example, criminal justice reform. We have a lot of people who are formerly incarcerated or family members of people incarcerated. And we're trying to kind of bring those communities together to have the power to make a difference and to act on our values. Myself, my own path is a little bit circuitous. I grew up very middle class in a small town in Wisconsin, kind of moderately religious. And it was when I was in college that I went to work as a volunteer in Guatemala. that I suddenly got this, I suddenly kind of saw another reality that was so different than the reality I grew up with.
Mm.
And kind of the thing that hit me was, boy, they lied to me in school, in church, everywhere, on TV about how the world worked. I really grew up thinking the world was fair and thinking that if people worked hard and they were honest, that life was going to work out for them like it had worked out for my folks. And I kind of realized I'd grown up in a bubble, and I to this day I resent that. and it's like I want to be determined to stay out of the bubble, and I want to be determined also to say, to make the world what they told me it was supposed to be, so that it really is fair for people, for everybody. And there's so many things that get in the way of that, so there's lots to do.
Yeah. Thank you for sharing that story with us about what brought you to this work. And earlier when I was doing this introduction, I was talking about these tensions that happen because um, religion does have a troubled past in some way, and we know that's been used to justify genocide and used to justify systems of oppression. So let's just get that elephant out of the room. How do we justify, the weaponization that we've seen of faith with its potential to actually dismantle oppression?
Yeah. So, I and the people I work with are just as dismayed, if not more dismayed, by the history of what religion has done. I mean, religion has done a lot of harm to a lot of people. And, the people who founded most of our faith traditions were people who were actually trying to reclaim them from powerful people who had co-opted religion and had used it to justify oppression.
Mm.
And that goes on today. That very much goes on today. I was recently at a conference about white Christian nationalism, which is this really insidious movement in our country that basically takes a political ideology and tries to bolster it with a lot of Christian symbols and language that basically is that, that exalts white people, that exalts the US, that says that we are a white Christian nation and we need to fight to keep it that way. And one of the participants in this conference was pointing out one of the big problems for us with white Christian nationalism is that people confuse it with Christianity, and it's not. So we're really about trying to sort of reclaim our faith traditions, which at their best are about standing side by side with anybody who's suffering. It's about being on the side of the oppressed. It's about being on the side of the people who really need to have justice brought to their lives, people who've been put upon. It's so for us, it's really important. It's about obviously living out our values in the public arena, but it's also about reclaiming our own faith traditions from the people who would try to hijack it to use it as some sort of a justification for unjust systems.
Yeah, thank you for sharing that. And there's lots of things that wisdom is doing in this space of justice and equity. What's the primary goal of some of these initiatives? And can you give some examples of the progress that you've made?
Sure. So the overarching thing, I mean, the things you see on your screen, for us, our leadership has really identified 3 values that we really try to kind of put into all of these things. One of them is the value of radical inclusion. And talk about things that can be tough for faith communities. I mean, when we're talking about radical inclusion, we're talking about everybody means everybody. So it means we have to get over whether it's race, whether it's national origin, whether it's gender identity, whatever it is. It's about, radical inclusion in every aspect of our lives, and people having the right to be included in the decisions that are being made about their lives. It's also, we have one of our organizations is called Minnesotans. It's on the Menominee Indian Reservation. And they sort of really pushed for saying, that just kind of lifting up the value of living for the 7th generation. Yeah. That we need to really be always looking at that has to be a lens that we see everything through. And then the third one is the value of costly reconciliation. Our faith communities, we believe in reconciliation, but not cheap reconciliation, not, oh, let's forget about it. Let's not teach about our racist past because that doesn't matter anymore. We've all put that behind us. That's not where we want to go. It's like, no, we really have to come to terms with the damage that we as a society have done to people, and we need to repair what's been harmed. We need to remedy the things that have been done. We can't just say, "Oh, geez, sorry about that. We promise not to do it again."
Right.
But we really need to pay a cost for reconciliation. Go ahead.
Go ahead.
Please.
Well, I wanted to say you can go ahead and turn your camera off just so we can hear you a little bit better, because you're sounding a little in and out for me. I'm not sure about everyone else, but that might help save some bandwidth. But go ahead, David.
Okay, I'll just actually lift up one example.
Mhm.
Is on environmental equity, environmental justice. We've really embraced as an organization, kind of again led by the Minnesotans group, the whole rights of nature movement. And it's a movement to get legal recognition that the natural world, waterways, habitats, animal species, whatever, has a right to exist, has a right to evolve, and has a right to demand a remedy when it's harmed. Current environmental law, for the most part, is actually just regulating how much we people are allowed to pollute. It's about our rights. It's not really about the rights of the natural world that we share the planet with. And it's, again, people of faith gravitate toward this. And again, recognizing that bad religion has also led to bad environmental practices, kind of a sense that somehow we're entitled to do whatever we want to, which I don't think is at the heart of what most of our faith traditions teach, but that's a really cheap way out of it. So that's something that's actually very exciting. We also do actually a lot of work on a lot of different issues, but I'll kind of stop there. But again, I'll stop there for the moment.
Well, I was hoping you could shed a little bit of light about your transformational justice and racial equity work that you're doing, and then maybe we can have some time to talk about your immigrant rights work too.
Yeah, absolutely. So transformational justice is really about completely reimagining the criminal legal system. It has to do with replacing punishment with healing wherever possible. The picture you see on the right there is one of our members who spent years in solitary confinement. And since he's been out, he actually built a replica solitary confinement cell on the back of a truck so he can take it around and actually take people in. So this is a judge that he's standing there with, that he wants to kind of see what's the reality of this. So it's really about healing rather than just punishment. It has to do with the way we treat people who are incarcerated. It has to do with keeping people out, people who need substance use disorder treatment, people who need mental health care, need health care. They don't need to be punished. So it plays out in all kinds of matters, large and small. It's probably the thing we do the most of. Right now, we just had a big rally in Madison last week about conditions of confinement in some of our prisons, which have really, unfortunately, started to deteriorate in recent years, partly having to do with personnel shortage. I think this is going on in a lot of states, but it's also not being dealt with as the kind of emergency that it is, because these are human beings who are being locked down.
Yeah. And then you have an immigration campaign that I thought our audience would love to hear about.
We do. Again, on immigration, we try to have the immigrant members of our organization lead the way and tell us what's important and tell us where we need to go. And then the church folks are there to help, are there to kind of back up that vision. We work on a lot of different levels. Our state is a little bit more frustrating of a place right now than Minnesota, though not to get political, but if we get our gerrymandering dealt with, we might be a more interesting state for actually dealing with things on that level. But there's a lot of things on local levels that we deal with. And, for example, we have a lot of dairy farms and we have a lot of undocumented people who work at dairy farms. And, a really localized thing we've gotten several counties to do is to get sheriff's deputies to stop hanging out at the entrance of dairy farms, kind of looking for people to stop And that can lead to somebody being deported. It can be a horrible thing to get stopped.
Yeah.
And these are folks got no other way to get to work because we still don't have the driver's licenses here, though. As they just got. Congratulations to Isaiah and others in Minnesota. I know they worked on that for a really long time. But immigration it should be a no-brainer for faith communities. I mean, this is something that's in the Bible. Remember you were once strangers in a strange land. Welcome the immigrant as though they were one of your own. Treat them as a citizen. So that's something that a lot of faith people, if you remind them, and you kind of point it out, say, look, this is in your book. This is in the instruction book for your faith. So it's something that we really believe we need to keep people rallied around. To me, it's one of the ways to see a clear divide between real religion and bad religion is how people act toward immigrants.
Yeah. And so I'm hearing a lot of the things that you're talking about that kind of cross over into our space. You're talking about transformational justice. On one of your slides, you were talking about civic participation, getting the vote out. These are things that we also have an interest in. So, how has partnering with public health advocates helped your organization? In other words, how do faith-based organizations benefit from public health advocates?
So we benefit a lot. And actually, I just kind of happened to notice that there's several people on this call who we've benefited a lot from here in Wisconsin who've helped us very much. One thing public health does for us is it gives us a new way to understand and to talk about our issues. As faith people and impacted people, it can be easy for policymakers to write us off as some sort of kind of like ungrounded idealists or whatever it is that they think about us, or to treat the other people in our group as just people with an axe to grind. So public health, we love you guys because you've got like data, you've got numbers. We can actually say, no, we're not just imagining this. We can show you this. We can show you. It's sort of like to our members to say, yes, treatment alternatives to incarceration makes all kinds of sense and saves money and makes people better citizens in the future. To our members, especially the impacted people, it's like, well, duh, you need somebody to prove that?
Yeah.
But we actually do need somebody to prove that. And it's wonderful. Some of our relationships we've had with public health has helped us to do that. So we have a new language that we can use. We can speak the morality language, we can speak the experience language, but to really be able to speak the numbers and the nuts and bolts language, it's been wonderful to be able to partner with public health folks.
Yeah, thanks for sharing that. As I wrap up our conversation, I, I want to acknowledge some of the things that you were actually bringing out, and Kathryn was too. But there is division in our country, and some of that division is racial. Some of that division is political. What gives you hope as you do the work that you do?
So, sometimes we actually manage to get some good stuff done. Sometimes we actually are able to make a change, and that's always hopeful. But in a
Yeah.
real sense, as a community organizer, the process is often the product. Just
Mm,
actually getting a chance to see people stop, give up on being victims and bystanders and
yeah.
say, you know what, I can actually be a real actor in my community. And getting to see people
Uh-oh. David actually froze on my end.
who are really, really play out from time to time.
Yeah. Thank you so much, David.
Ernest.
You froze a little
Okay.
bit, but that's okay. That's okay. I appreciate everything you said, and we got through it. So things happen. Everybody is
Yay.
familiar with all of these issues that happen with bandwidth. But I want to turn it over to Joanne because I'm sure that we've had a lot of questions. So
We
I'm gonna
certainly have a
pause.
lot of questions, Erica, and I'm just going to apologize in advance because we will not have time to get to everyone's questions. But I hope that we can hit on some really good ones that will be informative to everyone in the audience. And David, since we know that you're experiencing bandwidth issues, I'm just going to ask that you leave your camera off so that we can make sure your audio is as clear as possible. But I'm actually going to invite Kathryn back to the screen and start with her. So Kathryn, one of our attendees was really interested in this aspect of how you can get buy-in from different faith organizations to do the type of work that your group is doing. And this attendee explains that they're living in a rural area and they're experiencing challenges with getting folks from different churches, denominations, religions, races, etc., to work together on one common goal. A lot of the churches there do not want to work together because they see each other as different. So what tips would you have for sort of that cross-denominational or even being able to partner with people who are of different races and maybe don't affiliate with a certain religion?
Sure. Great questions. And I'll just first say it's really hard. And it takes long-term sustained work over time to try to build trust in community and to try to reach out and see who's open to the conversation. Like, do you have existing relationships that might be open to the conversation, or at least like, I know you're doing good work in the community already. I'm curious to hear why that matters for you. What's coming up in the community? What do you see as pressing needs? Some faith communities can be really great at like what I would call band-aid work or charity work, that calling to feed the hungry, clothe those who need it, welcome the immigrant and the stranger, and sometimes think about that as like an immediate institutional level, but not necessarily also swimming upstream to address the bigger root causes and partner with others in the community, recognizing the same issues and where we could have a larger collective impact together. And some aren't open to that conversation. Mm-hmm. Some are. And so kind of like start where you can start. We also see a lot of rural churches are dying, and that's really painful. And some try to hold tight to what they still have and are kind of in survival mode. And some are like, where are the young people? Right.
Yeah.
And that's really challenging in a lot of our rural communities. And I will say our rural organizing project started out of that recognition that our two-party system is leaving a lot of our rural people behind, because if you're basing that on how do you get to 50% plus one of the votes most efficiently, you're not taking the time to really build relationship and trust in community. You might send a whole lot of mailers to tell people who are what to be afraid of. And in southern Minnesota, what we see, and this might look different in different contexts, but a lot of white folks are really struggling. But the narratives are, if you're struggling, it's your fault, or it's your Black and brown neighbor's fault. And then when more communities of color are moving into our smaller towns and more of the factory jobs or things like that, they're feeling literally replaced and in competition where most of them want the same things,
right,
but they're being pitted against one another. Yeah, by often like corporations that leave us behind.
So when people lead with differences, I guess the first step is to try to find the common ground and lead with that instead. Thank you, Kathryn. I'm going to come back to you, but David, I want to welcome you back to the mic and pose a question from one of our attendees for you. And they wondered if you're familiar with the Centers for Faith-Based and Neighborhood Partnerships of Government, and wants to know how can we, as a faith-based public health community, work more collaboratively with the Centers for Faith-Based and Neighborhood Partnerships of Government agencies to address social determinants of health.
So I have to admit, I'm not particularly familiar with that agency. Yeah, so sorry about that.
Okay, well, maybe we can do a quick search on that and get some information for our audience. So I actually have a question that I think is appropriate for both of you to address. And That is, how does reparations fit into this movement? A good or a bad idea? And will that discussion help or hurt getting support for radical inclusion? And David, maybe we can start with you and then have Kathryn comment.
Sure. So internally in our conversations, absolutely. Reparations it's a matter of justice. That's part of what that whole costly reconciliation. We actually considered just calling it reparations when we were putting it in our values statement. One of the things, a little bit like what Kathryn was talking about with other things, is sometimes people can't get past the word. So you have to talk about the thing sometimes without necessarily using the word and get people into the concept so that it's sort of like, yes, we need to fix what's been broken. Yes, we need to make up for things. Yes, we need to, do all kinds of things. I think the concept is there. If you lead with the word, you kind of sometimes can create a brick wall. So I think we need to get to the word.
I love that. And that's because we are, those certain words come with, can be triggering for people, or it comes with stereotype perceptions. Yes. Kathryn, how about you commenting on that?
Sure. I'll say this hasn't come up maybe directly in my work in Southern Minnesota. So I'll, speak from my experience. I think it's come up maybe more in a conversation at the St. Paul city level, even, where they're trying to reckon with a history of redlining and communities of color being allowed to live in particular parts of the city, putting a highway through it, seeing communities of color are often devalued, and it intersects with housing and environmental justice, where there's more pollution put in communities of color and then left behind. So they're producing the least amount of pollution, but having the highest impacts. So the question of what does a just climate future look like? What does the just transition to clean energy look like? That's a question of reconciliation too, and funding those communities to be on the forefront of good clean energy jobs, cleaning up their air and water, and like addressing those needs first too. Those are who are being historically left behind and directly impacted the most.
Thank you for making that bridge to environmental justice. That's really relevant. Okay, still for both of you, a great question from Christian. And I think, Kathryn, you had mentioned how even during the pandemic, your organization persisted and still did the work. So Christian wanted to know how each of your organizations utilize social media and marketing to expand your message and reach and partnerships. So Kathryn, do you want to start? And then we'll have David chime in on how his organization's using social media.
Sure. I remember at the beginning of the pandemic when we were starting to learn this virus is moving into community spread and trying to look, what the heck did that mean? And our director having a conversation with us about our health and well-being is interconnected, and public life is not canceled, even if we need to stay home or stay away from each other to keep each other safe more. We still have to be lighthouses through this incredibly challenging time and figure out how do we do like public life and beloved community differently. So a lot of my work, tried to connect more people by Zoom, but in rural areas that ran into challenges with internet access, of course. I think our communications team has done a fantastic job of like leaning into social media more. And we try to train our regular people, with race class narrative and to move their own relationships on Facebook, or, get on Twitter as the as the place where politicos and media are paying attention, and how do we be a megaphone for what our communities need. Our Young Adult Coalition actually started during the pandemic, and meeting young people in that space that feels more part of their daily life and where they could build more of those connections. So I organize older generations maybe more in churches, and it feels a little newer to them, and our younger generations have stepped into that space more.
Thanks. Erica, do we have time for David just to comment on Wisdom's social media?
If he can keep it brief.
Okay.
Yeah.
I'll keep it really brief. So I got to say we're latecomers to that. I think actually the pandemic was good for us in that sense. We're all about relational organizing. What we're always talking about is building relationships, doing one-on-ones, talking to people. So we resisted doing much. Now we're actually realizing there can be a continuum, that it's not just abdicating, dealing with people person to person, but it's actually another way to invite people in. And it's another way to connect. So I was actually very excited last Tuesday when we had this big event at our Capitol. I met like 20 or 30 people who actually found out about us on social media. And it's like, you're kidding, really? That actually works. So we can't have it as the only thing, but it does help.
Yeah. Yeah, thank you both. And we are looking forward to having more conversation with David and Kathryn in the discussion group. Right now, Colleen has chatted out a link to our survey, and I'm going to ask that you can click on that link and save that link so you can fill out our survey. Because we do listen to what you say, and it helps us guide our webinar content. So thank you for completing that survey in advance. And we're curious if you are attending APHA, which is the American Public Health Association meeting. If so, please stop by the County Health Rankings and Roadmaps booth to meet us. And last month, you'll remember that Richard Rothstein was our guest, and we're going to be sharing some copies of his newest book, Just Action. And so we would love to meet you. So come by and visit with us and let us meet you face to face. And next month, we will be exploring a sobering topic, and that's gun violence. Now, many, if not all of us, has been touched in some way by gun violence. The question is, what can public health do about this epidemic? So we'll be joined next month with Dr. Monique Williams. She's the Executive Director of Cure Violence Global, and Raina Epps, who is a hospital responder supervisor at King of Kings Foundation out of Brooklyn, New York. No, it's actually Jamaica Queens, New York. And they're going to be exploring this topic with us. So be sure to register for that webinar. You can all go to our website right now and register today. And right now, Colleen's going to go ahead and chat out the link for the discussion group. And I certainly do hope that you will be able to join us to continue the discussion with David and Kathryn around partnering with faith groups. Again, they're facilitated by Joanne, and they're always really good. They give you a chance to chat with each other and share some resources and also learn from each other. Be sure to stay in touch with us through social media, David. And by subscribing to our newsletter. And I want to thank David Liners and Kathryn Lozada again for sharing their wisdom with us. And thank you so much for all that you do for equity in your communities. I hope to see you in the discussion group, and I look forward to seeing you next month. Have a good afternoon.